Hi everyone, this is Bill Keck back again to continue our discussion of so-called academic health departments. So we talked last time about just what that kind of arrangement is, and that's a start. But really, perhaps the more important question is, why the heck do it? I mean, what are the benefits? So let's think about that for just a moment. What are the benefits to the health department to link up with an academic center? The benefits to the academic health center to link up with a health department? What's the advantage to the community and the population to actually do the work that's really required to make that happen? Okay, well, there are several things. First, look at it from the local health department's perspective. You know, a lot of health departments are just really small. I mean, we have a lot of health departments in this country that have 5, 6, 7 people. That means there's a real limit to the skill sets available. So if you could link up with people who have expertise in public health areas, that gives you access to things then, to information and to help that you might not have otherwise. Suppose you've got an academic institution nearby that needs to have a place to send its students to get practice experience. They have to do that, you know, if they're going to be accredited now. So that means they want to impose these students on you. Is that an imposition? Well, yeah, to some degree it is, but it's a heck of an opportunity too, because this gives you a chance to influence those students, to assess their capacity, maybe even to decide whether you might want to hire them one day. But it also then gives you another avenue of access to the faculty and their expertise. So that's a real advantage. When I was director of health, one of the things I really liked was having an epidemiologist I could call up on the phone when I got some weird question like, does coffee cause cancer? It was nice to be able to have that kind of expertise to back me up. It really makes a difference. If it also means that gives you greater opportunities to bring continuing education or training to your workforce, to the people who work for you, because you have direct access to experts in a variety of areas. Get them to help you keep your folks up to date. And there's nothing like students involved with your workers to make them want to be modern, up to date, truthful in what they understand and know about public health and its sciences. This gives you an opportunity to build relationships that are broader in the community. It gives you the opportunity to increase respect for public health in your community when you have graduates of the program who end up working in your community, and hopefully it would help you improve health status. And now that accreditation is available for local health departments, it's clearly helpful to have an academic connection, almost required, if you're going to be successful in your application for accreditation. Okay, now suppose you're in an academic health center or just an academic institution someplace, and you're looking to see why bother with all this. Well, if you're going to be accredited, you're going to need to find a place for students to have an opportunity to practice their craft, to take the learning from the book and the classroom and apply it to real public health problems. That means you need to connect. If you're a researcher and you're interested in community health issues, you almost certainly are going to have to link up with a local health department or some other local service provider in order to be eligible to get grant funding. That's really important. And then there's the opportunity for you to do that research and gain credit for it. So it really helps a great deal from that perspective as well. The community, of course, benefits because it brings these two entities together. It increases the efficiency that's there and increases, actually, in most cases, I think, the effectiveness of each organization, if you will. Because in the end, we're really looking towards the impact it would have on the public. And that impact should be that services are delivered that in ways that are scientifically correct, scientifically shown to be effective, with the end result, hopefully, that the community will be a healthier place to live in.